Hello, Diet Tribe. Welcome to another episode of Let's Talk Diabetes with Nkirika, where I always share life-changing tips through a lived experience lens. I'm so happy to be back again after being away for about 2 weeks, and I'm back with a bang. And in the next couple of videos, I'm going to be sharing with you every knowledge about diabetes that I have garnered from the just concluded IDF Congress in Bangkok. And today I'm going to be discussing modern standards of diabetes care beyond the HbA1c. In the last 4 years, when I started using my continuous glucose monitor, I always asked my diabetologist why we never use the time in range as a better standard of care beyond the HbA1c. He never gave me a very cogent reason, but thankfully my questions were answered by Professor Sufyan Hussein in one of the sessions I attended in the just concluded IDF Congress in Bangkok a few weeks ago. So now there's a growing recognition that managing diabetes effectively actually goes beyond looking at just the HbA1c levels. So while this HbA1c levels gives a general picture of your average blood glucose over 2 to 3 months, it actually misses out on very, very important day-to-day variability in your glucose levels and other crucial factors. So I'm going to talk about 7 key standards of care beyond HbA1c. So you don't have to wait 2 to 3 months to check your HbA1c to tell you how well your control has been over 3 months. So with the 7 standards of care that I'm going to talk about, you can use this to assess how well you as an individual has self-managed yourself well enough to keep your blood sugar levels under control. So the first one is the time in range. So what actually is this time in range? Persons who use the blood glucose meter might not be too familiar with this term, but for persons who use the continuous glucose monitor, this is a common term we always keep an eye on because we always want to be 70% time in range. So what is time in range? It's actually the percentage of time a person's blood sugar level stays within the target range, which is usually between 3.9 to 10 millimole per liter or 70 to 180 mg per dl. So I'm sure the next question that might be going on in your heads is, why does time in range really matter? It actually gives a clearer picture of your glucose control and daily fluctuations. So no averages are measured here. Daily fluctuations and a much clearer picture of what's going on every minute in your body and how your blood sugar goes up and down depending on activity, meals, or your mental state of mind. So the time in range just puts everything into perspective. So the second is the glycemic variability. So what does this actually mean? The definition is just degree of fluctuations in your blood glucose levels. So what is the goal of keeping an eye on the fluctuations in your blood glucose levels? So this will help you do something when you realize that you've got large swings in your blood glucose level. You know what to do and you get it sorted. So the significance is that when you have very high variability in your blood glucose level, it's actually linked to increased risk of complications. So when you notice a trend in your glucose levels, having too many large swings, this can give you an idea of, you step back and you look at what and the things causing this large degree of fluctuations in your blood sugar levels. And then the third one is your continuous glucose monitoring metrics. So for persons using the CGM and are on insulin, we're always we always have like certain things that we look out for, or certain metrics that we look out for in our CGMs, and this helps us to know how well we are doing. So I've mentioned one of them already. That's the time in range. This is our best body. We always want to know that we're in like 70-80% time in range. We're always excited when we see that. And you also have to understand the time above and below. So the time above and below, this helps you know what to do in terms of how you manage your insulin levels, how you make adjustments to get your levels back to time in range. And the last is the glucose management indicator. So this is an estimate of your HbA1c from all your CGM data. So the fourth is your hypoglycemic monitoring, or hypoglycemia monitoring. So you need to understand and know what levels means hypoglycemia. So I'm going to classify this into 3 levels. And the level 1 is usually when you're less than 70 mg per dl or 3.9. So if you know this level, you know what to do, you know what treatments to use. And then the level 2 is when you're less than 54 mg per dl or 3 millimoles, so below, you know what to do. So the standard hypo treatment for levels 1 and 2 is the 15-minute hypo treatment rule. So you treat with 15 grams of fast-acting carbohydrate, like your juice, your sweeties, your glucose tablets, your Lucozade or fizzy drinks. So 15 grams, you check after 15 minutes. If the levels have not increased to about 5 millimole per liter or 90 mg per dl, you repeat it again. 15 grams of fast-acting carbs and check again in 15 minutes. And the level 3 is actually the severe, where your levels are running in 1 point or 0 point. You could actually pass out, and you need severe help, and this is actually treated in the hospital. And knowing what is causing your frequent hypo episodes will make you also know how well to adjust your treatment and your medication or insulin intake. So you need to really understand what to do, what numbers signify hypoglycemia. So the 5th is the cardiometabolic health. So this actually means health of both your cardiovascular system and how your body processes food and uses energy. So you have to know the right blood pressure level. The benchmark is usually 130/80, but it can be individualized based on so many factors. And then you need to know what your lipids are. So the control is always based on risk factors. If you have risk factors for developing atherosclerotic cardiovascular disease, and checking your kidneys, you need to know what your EGFR and your urine albumin creatinine ratios are. So with all of this, if you see that they are all tilting out of range, this will also give you an inkling to tell you that there's something wrong with your blood sugar levels. So if your blood sugar levels are playing up, it impacts on your cardiometabolic health. So this can also tell you that things are not going well with your blood sugar. So rather than waiting 2 to 3 months to check your HbA1c, this can also give you an idea as to what is going wrong within you. So it's also important to keep that at the back of your mind. And then the sixth is weight and lifestyle. So with poor lifestyle, we know that it equates poor diabetes management. And I can't overemphasize the importance of nutrition, physical activity, sleep, and mental health. Is very, very important. So what are tools that you can use to achieve good weight, healthy weight, and a good lifestyle? You need to have a nutritionist on board, and you need to have very good and sound diabetes education and very, very, very good behavioral support to help you, especially in your mental health. So the seventh is very, very important, and this is actually for us persons living with diabetes. We need to be focused on improving our quality of life. So how can we do this? We need to empower ourselves, and we need to understand, very, very important, I repeat, understand that treatment targets are actually individualized and based on factors like your age, pre-existing comorbidities, and risk factors. So do not compare your treatment protocol to another person. So you need to focus on yourself and what your body tells you. And you also need to have very good support system for your mental health. We all know that diabetes can be quite mentally draining and can make you feel overwhelmed most times. So we need to focus on ourselves, and we need to make plans that are achievable, that are doable, so that our quality of life can be improved. So like I said before, you don't have to wait 2 or 3 months before you check your HbA1c to gauge how well you have done. With all these 7 standards of care that I have mentioned, it goes beyond. This gives you an idea of when things are going wrong and when you can come in, seek help from your healthcare professionals, and adjust your treatment plan and make your quality of life a lot better. So remember, my take-home message again is you need to look beyond your HbA1c for the real story behind your glucose results. So guys, remember, you like, share, subscribe, and hit the notification bell to get notifications when a new video on Let's Talk Diabetes with Nkirika is uploaded. Bye.